I would like to thank the organizers for providing me with the opportunity to address this esteemed audience. My report focuses on the clinical study regarding the efficient application of nanodevice in the comprehensive treatment of multiple sclerosis. Multiple sclerosis affects approximately 2.5 million people worldwide. North America and Europe have the highest incidence of the disease. The exact cause of multiple sclerosis remains unknown. However, it is recognized as an autoimmune disease in which body immune system attack the million sheaths that protects nerve fibers. Clinical symptoms of multiple sclerosis vary and may include cognitive disorders, vision problems, fatigue, numbness and tingling in the extremities, muscle weakness or spasms, impaired coordination and balance. At present, a cure for multiple sclerosis remains elusive. However, there exist numerous disease-modifying treatments that can efficiently decelerate the progression of this illness and mitigate both the frequency and severity of relapses. The use of nanodevices in the complex treatment of multiple sclerosis offers new possibilities for improving treatment effectiveness at the level of disease mechanism. In 1995, the Laboratory of Applied Nanotechnology of Belousov in Ukraine developed the world's first officially registered nanodevices for medical use. Examples of nanodevices based on biocompatible magnetite nanoparticles are micro-MHB, intracorporeal nanobiocorrector, and magnet-controlled nanosorbent for extracorporeal hemocorrection. This slide displays the in vitro impact of the showcase nanodevices on the aggregation erythrocyte within a patient experiencing toxemia. Restoration of the bioelectric charge of the erythrocyte out membrane leads to the elimination of SLUT syndrome, as clearly evidenced by manifestation of the effect. In addition, biochemical studies reliably indicate 1.5 to 2 times increase in glycolysis products in erythrocytes after their treatment with these nanodevices. In general, this determines the effect of improved microcirculation and adequate oxygen supply to tissue. The first slide displays the impact of magnetite nanoparticles on the immune system. The study revealed the following effects: increasing the phagocyte activity leukocytes and phagocytosis complexion index, restoration of the balance of immunoregulatory cells, sorption of immunocirculatory complex and lymphocytotoxic antibodies, induces total complement and heterophilic hemolysis indices changes. The next slide presents data on the sorption activity of magnetite nanoparticles toward various substances present in biological fluids. It is noteworthy that magnetite nanoparticles show strong sorption activity toward circulating immunoglobulins. Based on the physical-chemical properties of the nanoparticles, the results of numerous studies of their mechanism of action, biological structure, and environments in living organisms, and extensive practical experience of their clinical application, we have decided to use this knowledge to improve pathogenic potency of the treatment of multiple sclerosis. The main goals of the study is to slow down the progression of multiple sclerosis, improve the neurological status and general condition of the patients, and reduce the dynamics of spread of demyelinating foci in the brain. Material sense methods. A patient diagnosis with multiple sclerosis, secondary progressive type of cause, cerebrospinal form, clinical aggravation stage, EDCC, neurological status, and disability assessment scales, contrast-enhanced MRI of the brain. The dynamics of changes in the neurological status were studied using a modified multiple sclerosis patient assessment scale. For quantitative assessment of disability, Kurz-Conline EDCC calculation was used. The manifestation of force of cerebral demyelination were studied using contrast-enhanced MRI. An oral form of nanodevice microMHB was used as immunosorbent and immunomodulator. The choice of the regime and dosage of microMHB was personalized. The next slide shows the scheme and dosage of microMHB application for a particular patient. The time and speed of appearance of signs of improvement of general condition and recovery of neurological status were taken into account. Results. 1 week after the use of microMHB, there was noticeable improvement in the patient's neurological status. The patients noticed a significant decrease in stiffness and rapid fatigue in the lower extremities. Objectively, the gait and coordination improved. The hand tremor decreased. Depression and concentration disorders completely disappeared. Appetite restored, and speech improved. Contrast-enhanced MRI examination of the brain after 4 months of use microMHB showed for the first time a decrease in the number of new foci of demyelination in the brain. After 6 months of treatment, the total score dropped by 210 to 45. The EDC disability score decreased from 6.0 to 5.0. The positive dynamics of normalization of the neurological status correlated with the results of brain MRI. The primary mode of action of the microMHB nanodevice is based on the sorption properties of the nanoparticles against antibodies, which cause autoimmune damage to the myelin sheaths. The process of restoration of the central nervous system activity in multiple sclerosis is due to not just to the immunosuppressive properties of magnetite nanoparticles, but probably also to the activation of remyelination mechanism and oligodendrocyte differentiation due to enzymatic methylation. The mechanism of the effect of magnetite nanoparticles on oligodendrocyte maturation may be due to the following. As a result of glycolysis activation, the amount of macroenergic compound ATF increases, as well as formation of the reduced form of the coenzyme nicotinamide adenine dinucleotide phosphate with the transition of the oxidized form of glutathione to the reduced form. In turn, this creates conditions for triggering enzymatic methylation process. The latter most likely complements the mechanism of action of magnetite nanoparticles microMHB. Ultimately, it provides differentiation of oligodendrocytes and the process of remyelination. It is also necessary to consider the fact that the magnetite nanoparticles polarize the aqua sector of the cellular microenvironment. As a result, the hydrolysis of the phosphate residue of ATF is activated, a quantum energy is resolved and ADF is formed. Taking into account the positive dynamics of the neurological status, it was decided to continue to use a nanodevice microMHB according to the specified dosage. The therapy was supplemented with a complex of rehabilitation exercise aimed at the earliest restoration of physical, cognitive, and psychosocial function of a patient with multiple sclerosis. Conclusion 1. The results of the study expanded the range of clinical efficacy of biocompatible magnetic nanoparticles in the therapy of severe autoimmune diseases. 2. The use of nanodevice microMHB in the treatment of multiple sclerosis had a pronounced positive clinical effects on the restoration of neurological status, objectively contributed to the reduction in the number of new foci of demyelination in the brain. 3. The process of recovery of central nervous system activity in multiple sclerosis is not due to the immunosuppressive properties of magnetite nanoparticles, but is probably caused by the activation of remyelination mechanism and oligodendrocyte differentiation through enzymatic methylation. 4. The use of biocompatible nanodevice in the complex treatment of multiple sclerosis is a promising direction. 5. The scheme and method of using biocompatible magnetite nanoparticles to improve the effectiveness of multiple sclerosis treatment require further improvement and study. I would like to conclude this report by addressing a common question. Can other form of nanoparticles be useful in the treatment of multiple sclerosis patients? The answer is mostly negative. It is important to know that nanoscale is not yet nanotechnology. The individual physical-chemical properties of nanoparticles are critical to the mechanism of their effects on biological system. Could the magnetite nanoparticles have favorable clinical effects on other autoimmune diseases, and do they really have this potential? At present, we have sufficient clinical experience of the favorable effect of magnetite nanoparticles on immune system parameters and other autoimmune diseases, rheumatoid arthritis, systemic lupus erythematosus, autoimmune hepatitis, and others. Can the described mechanism of action of magnetite nanoparticles be used for the treatment of other diseases? Certainly, they can. In particular, for effective hemocorrection, increasing the storage time of blood cells and restoring their functional activity. Treatment at the ultrastructural level of diseases of the liver, lungs, kidneys, and other organs. I apologize for my English. Thank you for attention.